Good evening, everyone. A warm welcome to Puberty to Menopause, a platform brought to you by the Human Biological Institute. I am your host, Binatos Bisoi, and I am thrilled to have you join the another episode. We talk, do you? Our mission is here to the Puberty to Menopause is to empower your knowledge about the various health conditions. We believe that the awareness is the first step towards better health. So today we are going to talk about hepatitis A. So before that, we want to introduce about our company, Human Biological Institute, is the surfing global healthcare by spreading the One Health initiative. IAL was established by the National Dairy Development Board in 1982. The HBI was established in the year 1998 when the government of India requested IAL to produce the modern tissue culture anti-rabies vaccines to phase out the unsafe nerve tissue vaccines. The first manufacturing facility of HBI was established at Uti. Subsequently, HBI launched other vaccines, and currently we have the major player in human vaccines and a leader in anti-rabies vaccine segment present in around 60 countries. Three state-of-art manufacturing facilities at Uti, Gachibowli and Karakpatla, that is Genome Valley. HBI has forayed into the market in clinically proven wellness products and infertility range of hormones. In terms of our vision, mission, and values, our vision is shaping the global healthcare by spreading the One Health initiative. In mission to innovate, produce, and market quality healthcare products to service, improve, and extend the lives. And in terms of value, we believe in the providing the affordable products with high quality throughout the technical innovations and improve to meet our customers' need. And let's feel proud for our green initiative. As a market leader, we have taken a significant step to reduce the plastic burden by 160 tons per annum. These are our CSR activities where adopt the government schools like gift meal program for through the NDDDB and IAL donates the oxygen cylinders plants at Gachibowli plant. Today, we are going to know about hepatitis A. To guide us through this important topic, we have the privilege to hosting Dr. Mr. Shreyas Vaidya, a highly respected consultant pediatrician and neonatologist with an MBBS, MD, and FNNF. Dr. Vaidya brings the wealth experience from the work at SS Memorial Shreyas Hospital in Siddhipuram, Karnataka. So let's start our today's talk on understanding hepatitis A and prevention. And let's welcome to our Dr. Shreyas Vaidya.
Thank you for the introduction.
Hello, doctor.
Yeah, hi. So you already introduced me. So I'm Dr. Shreyas Vaidya. I'm consultant pediatrician and neonatologist from Karnataka. It's my pleasure to be with you here today, and we are discussing about a very small, very teeny virus, which is only hardly 23 nanometer in size, and which creates lots of harmful things to human beings. And I'm very keen to tell all about that.
Thank you so much, doctor. You are giving your precious time to us. We want to know a little bit about hepatitis virus and what is hepatitis.
Yeah, let's split the word hepatitis. What is hepat? Hepat or hepar is Greek word for liver. Itis means inflammation. So this word indicates inflammation of the liver. So inflammation is in the sense when some foreign organisms attacks our liver, because of that liver gets swollen. That is hepatitis.
Okay. And what are the types of hepatitis are there?
Yeah, very good question. Hepatitis types are based upon the causative agents. So, like lots of foreign organisms can attack our liver. For example, we can by the causative agent which attacks our liver, we can classify it simply as caused by the viruses, caused by the bacteria, caused by the protozoas. Protozoas means like malaria. Example is malaria. In among viruses, we have hepatitis A, hepatitis B, hepatitis C, hepatitis E, and also hepatitis D. All these things. Also, even other viruses than non-hepatitis, I can mention dengue virus. Uh, Other than that, there are also bacteria. Most common example I can give you is the typhoid virus, the typhoid bacteria, which is Salmonella typhi bacteria. Those it can affect. Apart from that, hepatitis also can be caused by various other toxins, which can be drugs, which can be simple drugs like paracetamol also. By this category, we can by the causative agent we can classify like this. By the duration of illness caused by any substance, we can classify it as hepatitis, acute hepatitis or chronic hepatitis. Acute means which the disease illness will last for only 4 weeks. Chronic means disease illness is caused more than 6 months. 6 months. So by this way, we can categorize hepatitis.
Doctor, how the hepatitis spreads to us?
Yeah, hepatitis we can't generally say the spreading mode. For example, for hepatitis A and E, it's little bit similar. For hepatitis B and C, it's little bit similar. Hepatitis, why I'm talking about only hepatitis viruses, most common cause of hepatitis in human beings is caused by hepatitis viruses compared to the other viruses. So when it comes to the hepatitis A and E, hepatitis A, it's spread via fecal-oral route. Fecal-oral route means we have a person who doesn't care about his personal hygiene. He doesn't wash his hand. He consumes water which is unclean, not fit. He lives in a poor sanitary area where there is mixture of feces and drinking water. So uh, that's how human beings get infection. Basically, poor sanitation, poor hygiene, and drinking unsafe water and food, contaminated food, fecal contaminated food. When a person gets infected from a hepatitis A and E, when disease spreads inside the body, when he excretes his feces or stools, it is present in his feces. That's how it spreads. For hepatitis B and C, it's a little bit different. Hepatitis B is mainly by blood using like using unscreened blood products or body fluids. For example, you are going a blood transfusion or you are getting a needle prick, unknown needle which may be used for some other person. By this kind, it spreads. It's mainly blood and blood products B and C
Okay.
spreads.
Doctor, what is hepatitis A?
Hepatitis A is when you call hepatitis A, it is disease caused by the hepatitis A virus, which is one of the most common cause. When you see the number of incidents of hepatitis and acute liver failure, Most common cause for hepatitis A and acute liver failure is caused by virus called hepatitis A virus. That is basically hepatitis A. The disease caused by hepatitis A virus is hepatitis A disease.
So, doctor, how the hepatitis A spreads to patients?
Similarly, I told you, it is mainly caused by drinking unsafe or clean water, living in a places where there is poor sanitation, having foods in a places where they don't follow hygienic protocols. They're using all unclean water. This is the main cause. So usually this disease, like when you're when you're going to the endemic area, India is an endemic area. Endemic area is the place where the disease is very common. That is endemic area. India is one of the endemic area because we are in a phase of developing, from a phase of going into a developed country from a developing phase. So it's very common we have poor hygiene. We like lots of people don't get clean water to drink, and our food regulations are very not strict. So these are the reasons. While by consuming the water which is infected with hepatitis A, means it, I told you, it spreads via fe- uh, feces. It is excreted in the feces. So by drinking unsafe water, by living in a places where there is no access to clean water, or drinking or eating a food outside food which is not where they have not followed the proper protocols of hygiene, by this way hepatitis A
So,
spreads.
doctor, who are the persons like it for the high risk of hepatitis A?
Hepatitis A risk, very good question. Usually, like literally everyone who are unvaccinated, okay, or who have low, like when we, like usually in India what happens is, so few of the times when you get a hepatitis you get unnoticed, because like less than 5 years of age, it causes a hepatitis without causing the jaundice. So usually, like if you're living in a India which is highly endemic area for hepatitis A, like one, in some point of the time you might have already exposed to hepatitis A virus, but like we have to check whether you have proper immunity for it. If you are not if you don't have the immunity, you are also susceptible. So everybody, like since we are living in India, everybody is at high risk for hepatitis A.
So, doctor, is there any way is there to prevent hepatitis A?
Yes, like I told you, the causative, what are the causes, how it spreads, what are the precaution you should take, like already you know it. First thing is, you should keep your environment where you live everything clean. Proper hygiene, education is very important for that, and access to clean water to everybody. Maintaining food hygiene, and those who cook food, they also should follow the protocol. They have to use the clean food. One more important thing what you can do is, if you are traveling to a very high endemic area, or if you feel I should be safe, you can get vaccinated, and so that your body produces an immunity against the viruses. If you get attacked, the vaccine will protect you. That's the by this way you can prevent. First thing is this, the first most important point is the personal hygiene and keeping your environment clean. That is the most important.
Doctor, is there any a vaccine available for hepatitis A?
Yes, we have vaccine. Usually it is not, you might be knowing, we have something called as national immunization program, which is not there in the national immunization program. It might come soon, we don't know, but it is available. We have a vaccine. We have two types of vaccine actually. One vaccine which contains a killed means, and one more we have, in that we have a live vaccine. But it cannot cause the disease, but it can produce the immunity. The vaccine usually most commonly used is the formaldehyde killed vaccine, where the in that vaccine we have a virus which is killed, which is not alive. vaccine to the human body, will start producing the antibodies. That means the immunity, which is required for the further protection. Usually, once when you give the injection, within the 4 weeks, like you will be protected against the hepatitis A. For that, we have only simple 2 doses, which is usually in India how we practice is after the 1 year of age, it is given to everyone. Okay, if you have a kid less than 5 years, after 1 year, we should give the vaccine. We have to the number of doses will be the 2 doses. We have to at least maintain the 6 months apart. That's all. That's very simple. And one more, which is given into the muscle. So this is the commonly used vaccine, and this is how you give it.
So, doctor, how does the hepatitis A vaccine protect people from hepatitis A?
Yeah, yeah. As I told you just now. So, like when you give the vaccine produces one immune response. Immune response is like our body immune system will recognize that we have something foreign body inside our system. So we give this vaccine to the muscle. When we give it into the muscle, our immune system will recognize it. Oh, there is something new, foreign body inside the human system. So the it will start attacking. Our immune system will start working, and it will start attack the foreign body, and against that it will produce the immune response, which contains like antibodies. We call it antibodies, means the immunity against the hepatitis A, which like it will take some time. It will not happen immediately, but it will take for 4 weeks to establish the full immunity. After the 4 weeks, if you get a virus also, like our immunity will be very strong because of the vaccination, and it will kill all the like it will at least reduce almost all the symptoms and doesn't cause any like complications. So this is how it works, vaccine.
Okay, so doctor, how safe is the hepatitis A vaccine for people?
Yeah, it's like efficacy in the sense when you give the vaccine, the amount of response it produces, as per the literature and the recent studies, it's 95%. So any vaccine like which has a good efficacy, we call it efficacy, which is so it is very safe also. So hardly as per my experience, and also as per the local pain when you give the injections, and also it might cause low grade fever. That's all. It's very safe. It doesn't cause any complication as of now. As per the studies worldwide, it's very safe.
Okay, so thank you so much, doctor. You give a lot of things and lot of knowledge about our hepatitis and what are the types of hepatitis and what's the hepatitis A and who are at risk and what's the vaccination schedule and each and every point of hepatitis A.
Thank
So,
you,
doctor,
thank you.
it's time for to let's take few questions from our chat box from our audience.
Yes, yes, definitely, definitely. And I would like to tell why we are discussing hepatitis A. So once I mentioned actually, this is the most common type of hepatitis. Okay, usually it is less symptomatic under 5 year of age, means younger children. But after the 5 years and adults, sometimes it will cause little bit of complications and all. What we call as acute liver failure, where you see people developing jaundice, all those things. So it is the most common cause of hepatitis. So this is very important. So everyone should be aware of it. So everyone should know how to prevent it, and they know, and everyone should know there is proper precautions we can take, like vaccination, to prevent it. So that's what I wanted to convey to everyone during this. You can go with the questions.
So, sir, one of our audience have put a question like, what advice would you give to parents who are hesitant to about vaccinating their children against hepatitis A?
Uh, It's it is not included in the national immunization schedule. Otherwise, it would have been a compulsory vaccine. Did you get that? Since
Okay.
it is not causing the harm like other diseases like tuberculosis or hepatitis B and all. Right now, it is not included. But I can tell you, it is very safe vaccine. Like it's a small investment so that you can give a vaccine to your child, and you can, it's totally safe also. Right now, no complications because of vaccine from hepatitis A, so that when he grows old and all, he is protected against hepatitis A. And that is the age after 5 years, or when he becomes the adult. If he gets a hepatitis A disease, it will become more complicated than a like when if he gets in a childhood. And it is very uh, he might have a jaundice, he might have chronicity. Sometimes it might go into a chronic phase also. So it's better to get a vaccine early in the life, or if he is not immunized at all, he can get the vaccine also. So it's very safe. So please do not hesitate about it. Get more informations.
So, doctor, another one is there. Are there any long-term effect of hepatitis A that I should be aware of?
Just now I told you, for less than under 5 or of the age, it doesn't cause much complications. Like I mean, in the old childrens who are greater than 5 year of age, and also in the adults, it might that is there. The going into an acute liver failure. Acute liver failure is like you get the disease, the viruses will be very strong. It can attack your immune system, and it can attack your liver also, so that your liver stops functioning for some days. You might require admissions and all. And also, like in adults, we have seen that it might cause sometimes the hepatitis A infection might cause pancreatitis. So, and very rarely it can cause chronicity. Like it will attack your liver, and it might remain for some time. All these issues, like you might get hospitalized, you might get, if the acute liver failure is very high, you might get like lots of issues and trouble. Definitely, you might have a ICU admissions. All those things might happen. So there are a few configurations. So prevent that, especially why I'm saying is we are living in India. So we have, it is an endemic area. In the world, only the Asia and Africa, these two are the endemic area. In Asia, India is the endemic area. So it's better to keep our health safe.
All right, doctor. Doctor, another question is there. If a child contacts with hepatitis A virus,
Hmm.
what is the type of course of treatment and recovery?
Yeah. Less than 5 year, you might get unnoticed also. Less than 5 years, because it is a mild illness in them, you might get unnoticed. So after the 5 years, child might become yellowish. Few of the symptoms I would like to tell you is, so sudden onset of loss of appetite, nausea, is unable to do anything, yellowish discoloration of the eyes initially, following yellowish, and there might be also yellowish discoloration of the urine, and also he might get mild fever and pain in the upper part of the abdomen, where the liver lies. These are the symptoms. So usually the hepatitis A illnesses is mild, almost like 90 to 95%. If you like maintain the hydration, so whenever we have the like hepatitis, usually we avoid fat and oil, because uh, for like liver won't be functioning during that time. So we have to do not pressurize the liver to work. So we put them on diet. Most probably, we might suggest you to give some vitamins. Also, to comfort him, the symptomatic management for fever we might follow. This is the usual course.
And doctor, another question is there. How does hepatitis A virus different from hepatitis B virus and hepatitis C virus?
Hepatitis A is mainly spread from fecal-oral route. I told you just now. Hepatitis B and C are a totally different thing. We have immunization for hepatitis B also, which is a compulsory vaccine given to everyone. We give it at birth, we give it at sixth month, sixth week of life, we give it at 10th week of life, and we give it at 14th week of life, which is a compulsory and a mandatory vaccine for all. Okay. The mode of spread of hepatitis B and C is similar. I told you already, and which hepatitis B and C diseases by sharing like their blood products or the any body fluids. Okay, like if you have a cut and if you put the blood of an infected hepatitis B virus, it will spread. In a simple words, if I can explain you, it's that way. Those two are little different, and something called as chronicity. I told you there is acute hepatitis and chronic hepatitis. The chronic phase of the hepatitis is present in hepatitis B and C, but it is not present in hepatitis A. That's why it's a little bit safe. This is totally different thing. So you should the precaution wise also you should not share common, like in simple scenario, like you should not use the used blades. So if someone has used the razor blade, you should not use it. Or like you should before going to a hospital, you should check whether they are using the same injections or not. The used injection might contain blood from a hepatitis B patients. All these precautions you should say. It's a total different thing. So usually there is no vaccine for hepatitis C. Right now there is no vaccine. Hepatitis B is a different type of virus, which is a little bit similar to the hepatitis C. For that, we are vaccinated. Everyone in India is vaccinated, and it is a mandatory vaccine also.
Okay. So, doctor, one of our audience want to ask how effective is hepatitis A vaccine?
Hepatitis A,
Vaccine.
vaccine is very efficient. I have like yesterday I have gone through the literature also. It is 95%. What I'm saying is the killed vaccine, which is commonly used everywhere. The formalin killed vaccine, whatever is there, it is very effective. The efficacy percentage is 95%. It will be more than that only. Once you give the vaccination, within 4 weeks, the antibodies will be present in the body, but it is not for like lifelong. It will at least last for 25 to 30 years. Once you vaccinate your kid, it will definitely last for 25 to 30 years.
Doctor, one more question is there. Can hepatitis A vaccine be given after exposure of hepatitis A virus?
Uh, it depends upon the amount of antibodies they have developed. Okay, like you have to undergo testing. If you have already have a hepatitis A, you should undergo the testing. Like if you have sufficient amount of immunity in the sense, no need for the vaccination. Okay, if you don't have sufficient amount of hepatitis A antibodies in your body, then you have to undergo the vaccine. It's simple, but it's decided by the doctor. Like you can't say like whether to take or not. So if you are not never exposed to hepatitis A, that we will come to know whether by the knowing the amount of antibodies you have. So if you don't have the antibodies, you should take the vaccine.
All right, doctor. So another is there, sir. How does hepatitis A impact a child's overall health and development?
See, the aim of the pediatrician is child should not have any diseases during the phase of development. any diseases, not just the hepatitis A, any diseases, if child suffer for like many days, 5 days, 10 days, if he gets if he gets sick and if he doesn't take food, he will end up in a malnourished state. Like like he will not get a proper nutrition during that time. The aim of any pediatrician is to prevent the diseases as much as possible, so that child can have a proper growth and development. This might cause, I won't say it will cause some major issues in growth and development, but it will cause, if your child gets hepatitis A and all, he might suffer for some days. During that time, he'll lose his nutrition. All these things might happen.
Okay, so all the questions are we almost all the questions you covered by from our audience, doctor.
Sure, sure. Thank you.
Thank you so much, doctor, for your valuable time.
Thank you.
And
Thanks to you as well as the Human Biological Institute for giving me the opportunity.
it was a wonderful session, sir. And we
Thank you.
wholeheartedly want to thank you so much for as a behalf of Indian Immunologicals Limited Human Biological team.
Sure. Thank you. Thank you. Thanks for
Thank
the
you so much,
opportunity.
doctor.
Sure. Thank you.